Hello and welcome. My name is Fritz Scalette, psychologist, and this is the Dr. Fritz Show here at CTV in Staten Island. And welcome to the very first episode. I'm a psychologist, I've mentioned, and I'm going to talk to you a little bit about what psychology is in a few moments. But I just wanted to take a moment to talk about my background. As a psychologist, I'm trained in psychology. I have a clinical degree in psychology, clinical psychology from Fordham University, and I've been working in the field of mental health for about 25 years. The program that I'm doing here in this studio is about the psychology of everyday life. And what I would like to do during every episode is bring you a little bit of information about psychology, stuff that I learned in school, learned throughout the experiences, so that you could apply it in your everyday life. So each time that we have this episode, we're going to take a path, we're going to walk along a path of everyday life and experiences, examine issues that are impacting us, talk about everything from depression to anxiety, stress management, problems and concerns that are affecting us. We might even talk about the impact of the wars that our country is fighting, and how it impacts you in everyday life. So before we get deep into the psychology part, let me talk to you a little bit about how I got started in psychology. I was a sophomore in high school, and a friend of mine said, "Why don't you come and sit in on this class, the psychology class that was being held at Pace University in New York?" And the course was entitled The Psychology of Everyday Life. And what the course instructor went through was theories of motivation, theories of the mind. He talked about Freud, the id, the ego, the superego. He talked about a variety of things, and I remember just sitting in the back of the classroom being totally fascinated with how an understanding of psychology could actually translate into an understanding of how to predict, understand, and even control and influence human behavior. To me, it was like an incredible remote control tool, a tool that allowed me to go into the world and understand things a lot better. So we fast forward 2 years later, when I finally decided to go to graduate school at Fordham University and study this material, and I've been fascinated ever since. So one of the reasons why I'm in this studio today is because I want to share that information with you and share it with the same kind of energy and passion that I experience it in everyday life. I want to share it with you because I want you to take that information and use it in everyday life, because that's what I do with my clients. I counsel them, I listen to them, and then take that information and help them in turn take it and use it in their everyday life. So early jobs in psychology back in the late 80s and 1990s included working in a psychiatric residence with schizophrenic clients. People had bipolar disorder, people had personality disorders. And then as I went through graduate school, I'd had different jobs, at times even moving away from the mental health field. For 3 years, I was a high school math teacher, where I often say I learned most of my psychology there because I got to actually apply it in a naturalistic setting. And now we fast forward to just a few years ago when I started doing a radio program at WWRL in New York City. And there on the radio, the show was actually called Ask Dr. Fritz as well, and people were able to call into the program and ask questions and talk about their experiences and participate in the discussion. So once again, I'm happy to be here in this studio, and I wanted to just give you a chance to meet me. So again, if you'd like to reach me and offer suggestions or become part of this process, go to AskDrFritz.com, and there my contact information is there, where you can actually follow us on Facebook and Twitter, use the social media, as well as participate in future programs. And the kind of people, again, that we're going to have on here could be you. It could be your community leaders, politicians, whoever has something to offer to the conversation. Now we're at the part where I'm going to begin to do what I call the Psychology 101 section. And again, I'm going to do this during every episode, have a segment where I talk a little bit about psychology in general. This is so that you get a foundation in what anybody who has gone to an intro psych class or an abnormal psychology class would get. And I want to use that, or help you use that, to be able to apply some of the things that we're going to be talking about during not only that episode and future episodes. So consider this like going to a psychology class and sitting in, although you won't have to take a test. That's an idea. Maybe we should do that. Well, we'll talk about that during future episodes. So Let's talk about what psychology is. Psychology is, and it's defined in many different ways, but it usually is defined as an academic or an applied discipline where we scientifically study mental functions or the mind and behavior. So psychology is the study of the mind and the behavior. I mean, some people might actually want to make that a more complicated definition, but when you go on the internet and research it, most of the definitions will involve something having to do with mental and having something to do with behavior. And it's important to know that because we're going to be, during this program, doing the same thing, whether we're talking about a psychiatric disorder or if we're talking about a social issue, we're still going to be looking at the interaction between our minds and our behavior, because wherever there's a human, there is psychology going on. And that's part of what I do, is I study situations and I look at it and I try to pull out the psychological substrates that are in there so that we can actually apply that in everyday life. Now, applying the definition of psychology, like I just said, the study of mental functions and behavior to everyday life, what does that look like to you and me? Well, you've probably wondered why people do what they do. Why is there road rage? Or why is there war? Why do people fight? Why do couples have trouble getting along? Why do we get stressed? I'm sure there's a number of whys that you may be asking. And one of the reasons why we're often asking why is because we're trying to understand it. We're trying to be able to get a grip on what's going on so that maybe we can, control it or influence it, or usually we want to stop it. Well, psychology has a huge contribution to this issue. Psychologists have been studying for the past 100 years, and through many different studies, why we do what we do. And there's a huge body of research that's out there that I intend to present to you, little bit by little bit, that'll help us understand why we do what we do. So let me talk about some of the major contributions of psychology. Number one, psychology is an awesome, I'm biased, of course, but psychology is the major contribution that's given to us is the ability to describe and understand human behavior. FBI agents, CIA agents, people who do profiling will use psychological research and experience to profile suspects who they're trying to find. They will use psychological principles to be able to figure out what they're going to do next, to understand the mind of, let's say, a serial killer. So one of the major contributions of psychology is to giving us a language to both describe and understand human behavior. Going forth from there, another major contribution of psychology is our ability to explain. Not only are we able to describe it in objective and at times subjective terms, but being able to now explain why a person is doing what they're doing. And of course, if we can understand why somebody's doing what they're doing, we may be able to do the next thing, which is predict. Predict what they're going to be able to do. Predict when a serial killer is going to strike again, or predict when the person you're in a relationship with is going to be in a good mood versus a bad mood. Understanding psychology, understanding the principles behind human behavior is quite helpful to that. And lastly, I mentioned it before, why are we doing all of that? In an effort to be able to change, influence, and at times even control the outcomes of things. So every episode we're going to talk about different topics, and I'm going to be bringing in these kind of basic themes into the discussion. When I did the radio program, we had various different topics and different guests on. At one point we did the psychology of the superhero. We did the psychology of comedy. We did the psychology of a variety of things, but what we were able to do with all of those examples and with guests in the room, we were able to help people better understand human motivation, emotion, intellect. We were able to teach people how to better predict what was going to happen in their lives, and we were actually able to help people even do their own self-therapy at times to deal with situations going on within. So a lot of those things that I'm looking forward to doing with you. So one of the questions most often asked to me is, what is the difference between a psychologist and a psychiatrist? The names obviously sound the same. And a lot of times I get phone calls from people looking for help, but they're actually looking for medication versus therapy. And so I'm going to take a few moments to distinguish between what a psychologist and a psychiatrist is. I'll start with a psychiatrist. A psychiatrist is a medical doctor who's gone to medical school to get training to become a medical doctor. After medical school, which is 4 years, they go on to usually about a 3-year residency in psychiatry. What the psychiatrist studies is something called psychopharmacology, and many also study neurology. What they are studying is the ability to treat people using medication. And so that becomes actually the biggest distinguishing characteristic between a psychiatrist and a psychologist. A psychologist, on the other hand, both of them, by the way, complete college, the psychologist goes to graduate school, where they go through an intensive study in research and clinical practice. Psychologists are the ones that are usually doing most of the psychological research that are filling our books for introductory psychology classes. Psychologists study the mind from the perspective of why we do what we do, and it's more of a conversation, so that by the time a psychologist is a practicing therapist or psychologist in everyday practice, the treatments they offer are usually more of what is known as the talk therapy. Now, I can spend a lot of time going through the different therapies, and I'm actually going to do that during future episodes to help you distinguish, but I want you to just first take a moment to distinguish between the two. Now, further complicating the matter in terms of trying to understand all the professionals in play, the mental health system has other practitioners who also offer various forms of treatment. There are social workers, there are licensed mental health counselors, and there are psychiatric nurses, just to name a few. Let's start with the social workers. Social workers, by history, are known for doing work on a social level in terms of, like, if they're working in a hospital, they help coordinate systems and get patients into programs. But increasingly, social workers also provide psychotherapy, talk therapies as well. So there's overlap between some of the therapies that social workers do and psychologists do. There are also nurse practitioners. Nurse practitioners are medically trained. They are RNs or nurses, and they are usually trained to also be able to potentially administer medication either under the supervision of a doctor and in some states alone. Nurses can also practice therapy if they so do, if they've got the training. And then lastly, there's licensed mental health counselors. Now, in the state of New York, licensed mental health counselors is a new, relatively within the last decade, discipline where people with master's degrees in psychology with additional training and supervision are able to work independently as licensed mental health counselors at the completion of their training. So, I mean, there you have it. I can talk a lot more about the different professions, and of course that I will, but I want to help you distinguish between the two because there's so many various forms of treatment, and when people are looking out there for treatment, it's often difficult to figure out where to go first. So I want to tell you one of the first things that you should do if you are actually feeling like you have a mental issue, or if you're feeling depressed or you're feeling anxious, is to actually go to a primary care doctor. The reason why you would do that is because in many situations, there could be an underlying medical reason as to why you are feeling the way you do, and a medical doctor can ask the right questions to help diagnose whether there's an underlying medical condition. If you were to go to another profession within the mental health profession without actually getting a medical clearance, what could happen is you might be treated for a mental issue that actually had a medical cause. So my recommendation always to people is to get a physical where there is even a blood test, where you can actually talk to your primary care doctor, and your primary care doctor should be able to know how to connect you to mental health services within your area. Once you've gone to the medical doctor, and let's say you're cleared, you're not found to have any underlying medical condition that might be causing you to feel the way you do, let's say they've given you a referral, or let's say they haven't given you a referral, there are also many resources within your community. In the city of New York, the recommendation often is to just have people go to nyc.gov. The website there's a mental health section that has a lot of different resources and a 1-800 number with people staffed to be able to connect you to a mental health professional. Other resources may include going to your local hospital or your local community service center. Again, there are a lot of professionals, and I always tell people to try and find something local, either close to home or close to work, so that you can always actually be able to get to your appointments, and so that you can not have too many excuses to not get to your appointments, because sometimes it can be very hard to find the motivation once you're engaged in treatment. Again, when you're trying to find someone and let's say you're feeling depressed or you're even feeling suicidal, this is something you want to share with the social support system around you. If you have a spouse, if you have siblings, parents, you do want to share those things with them so that they know what's going on. If it's a situation within which you're unable to share it with them, then of course, then use some of the resources that I have mentioned. So primarily, the first place I'd want you to go is if you're experiencing a mental condition and you want to find out whether something's really wrong with you, start with your primary care physician. Tell them what you've been feeling. They should have the resources available to them to connect you to a mental health profession. And if they don't, or if you're not satisfied with their suggestion, you can always look within your community, local hospital, community service center, often even the churches, the reverends or the community leaders and the religious leaders often have some training in what to do to connect you to the right person. And some of the counselors, some of the pastors are actually pastoral counselors. And so next up on the episode, we're going to be talking to Celestine Cox. She's going to be our first guest for this program, and we're looking forward to having her on here and talking about her organization and the event that her organization is sponsoring. We'll be right back. Welcome back, and next on the program is Celestine Cox. She is the second vice president of the National Council of Negro Women in Staten Island. She has over 25 years of experience in advocacy and human rights, and has worked with the United Nations to empower women and young girls through education. She has traveled to Ghana, Africa, and has worked with local officials there to increase the number of girls who attend school and finish school. She is a Staten Island resident and mother of 2 children. Welcome to the program, Celestine Cox.
Thank you very much. I'm very happy to be with you today.
Well, thank you for joining me. I mean, this is the first episode of Ask Dr. Fritz here at the studios of CTV in Staten Island. So I'm honored to have you to join me and bring the information and the organization that you work with to the program.
Thank you.
So I guess let's start off by telling us a bit about the organization that you represent.
Certainly. The National Council of Negro Women is a nonprofit organization. Mm-hmm. It was founded by Mary McLeod Bethune in 1935, and its mission primarily is to advance the opportunities and the quality of life for African American women, their families, and their communities.
Okay. Can you tell us about the area within Staten Island that you serve?
Certainly. We are in the North Shore section of Staten Island, but our reach is throughout Staten Island in its entirety. We reach out to the community through our various educational programs, our awareness programs, and through our giving.
Okay. Can you tell us a bit about some of the issues or the more recent issues that you've been dealing with within the programs that you guys run?
Certainly. Staten Island itself has 2 major issues that have been in the forefront of the media recently and on the minds of many of its residents. It's the issue of the high rate of cancer in Staten Island, and it's also the issue of the escalating rate of domestic violence in Staten Island. During the month of October, we focus on, as an organization, domestic violence, because domestic violence in the Staten Island community has increased 50%. And we have one of the highest rates of domestic violence out of the 5 boroughs. And it's a main topic that's on the forefront of our Councilwoman Debbie Rose's plate, our District Attorney Daniel Donovan's plate, and we like to keep in line with the issues that are impacting the community that we live in.
Okay.
Most of our members are from the Staten Island community and have lived in the community for many years, myself as well.
Now, do you have any information, or has any kind of outreach studies been done to talk about why there's been such a dramatic increase in recent years?
I think what has made the increase is that I think more people are becoming aware of the resources that are available for them to speak up and speak out about domestic violence. I think that through the various initiatives on the island. More people are coming forward. We also have a lot of domestic violence issues that impact teens and young adults. So that in itself will increase the number. I don't know if there are any other social.
If I understand that correctly, some of the increase that we're seeing is actually may not actually be an increase as much as it is an increase in awareness, and so now more people are coming forward to report being the victim of this.
Absolutely, and there are more resources available for the victim now. There are several initiatives that are on Staten Island per se. The anti-stalking bill is an initiative that is something that we're working on. We have a specific domestic violence unit within the 120 precinct. We have more information that's being disseminated through the schools, through the social organizations, churches, community-based organizations. I think through the empowerment of the resources and information, more people are feeling a sense of safety and a willingness to come and speak up about their issues.
So as you get the information out there, more people are aware of it. You've created a safer space and an awareness of that space to come forward and talk about it. Any other areas of impact that you've been having with that initiative?
Well, we have particularly been working on awareness programs. We will be hosting our second annual Domestic Violence Awareness Program on October 25th at the College of Staten Island. We partner with other organizations to bring this program each year. We are working this year again with Delta Sigma Theta Sorority, the Staten Island alumni chapter, as well as the Sisterhood. And the Sisterhood is an organization that is made up of various women's organizations on Staten Island. We bring together information through speakers. We're going to have this year the Commissioner of Domestic Violence from the Mayor's Office to Combat Domestic Violence. Her name is Rosamond Pierre-Louis. She'll be joining us this year to speak about the Mayor's initiatives and what their office is doing to increase information and resources to combat this problem. We'll have individuals who will be strong enough to share their stories and their experiences with us, and hopefully through their message they will empower and educate someone else who will be able to find the strength to come forward and deal with any issues that they may have. We'll be speaking about financial abuse, how that's handled and has become part of that is a part of domestic violence. We'll be talking about social media and how that impacts teens and young adults and their dating and how that is used as a form of domestic violence. And it's going to be an afternoon of information, we hope an afternoon of empowerment. And as we move together as a community to eradicate this problem and hopefully bring it to a point where it's non-existent, if that's possible.
Well, I think you're making a grand step toward it, significantly reducing this problem in our community. Can you walk us through, let's say you're doing the outreach and you get people that are identifying as victims. What process or what referral sources do you have in place to respond to people that are experiencing this?
Well, as I stated, we are an organization and our mission is to educate and empower people to help themselves. What we put together, and what we hope that we've put together, is the information that they then can take themselves and utilize. And hopefully, at the program, they'll be able to meet and connect with individuals there who will further be able to assist them with actually utilizing the services and any assistance that they may need.
Okay, so what you're providing is a platform for bringing together people that are going to speak on these issues and people who would probably be more primarily involved in taking people in who identify as the victims of domestic violence and then getting them to counseling or other social services. Is that correct?
Absolutely, absolutely. We're serving as a catalyst to bring the person who needs the information together with the person who can actually provide them with the assistance. We work on various initiatives. We also have an education initiative that we work on. However, domestic violence is something that we are really in tune with, especially during the month of October, as it has been designated Domestic Violence Month. And domestic violence is not gender specific, it's not race specific, it's not age specific. It impacts all of us in all of our communities, and we all possibly know someone who has been a victim of domestic violence or has been a victim themselves.
And so if someone's listening right now, I want to give something back to people who are watching this and would like some immediate information as to what to do if they are the victim of domestic violence or know someone who is. Who should they call? What should they do at this point?
At this point, I would advise them to call their local precinct on Staten Island. We do have a domestic violence task force within Staten Island at the 120th precinct. I would also advise them to reach out to the mayor's office on domestic violence. They have tremendous resources and information, and they would then be able to better link them with a service that will actually address their specific need. Staten Island does have an organization called Day One that works with young adults and teens. That would be another resource. And these are some of the linkages that would be provided if they were to call the mayor's office on the mayor's office to combat domestic violence, and if they were to call the 120th precinct on Staten Island.
Okay, so call the precinct, and they could probably help primarily with connecting people to available resources within their community. Now, if we want to get to this event, let's talk about how we get to the event. Give us the date again and where it's located.
The date of the event is Saturday, October 25th. It will take place at the College of Staten Island, which is located at 2800 Victory Boulevard in the Performing Arts Center in the Recital Hall. And we will be there from 12 to 5, and we hope to see many of the listeners and viewers there on Saturday the 25th.
Okay. And if we want to get in touch with your organization to support it, maybe do you take volunteers too?
We are always interested in increasing our membership with like-minded young women and women of any age who are interested in being part of the National Council of Negro Women. They can contact me directly. I am the membership head, and my telephone number is 917 769 0939.
Okay, can you repeat that again?
It is 917 769 0939.
Okay. I want to...
And I can...
Go ahead.
I'm sorry, and I would send them out a membership application, and we would welcome them and their energy and their support as we work to address the many issues in our community.
And as we talk about the community, where can we find you within the community?
Well, we meet the fourth Saturday of each month. We meet at the Bridgeview Community Center, and that is located at 150 Nicholas Avenue, at the corner of Nicholas Avenue and Castleton Avenue. And we meet there from 11 a.m. to 1 p.m., again, the fourth Saturday of each month.
Okay. I want to thank you for coming on the program. We're going to have this information in the show notes and available to anybody that wants to get to your event. I want to thank you again for the work that you're doing within the community and with that organization.
I want to thank you for giving me an opportunity to speak about that.
Okay, and the next event you have, you got to come in here and sit next to me so that I'm not so alone in the studio.
Oh, I will definitely make time for that. Thank you so much.
You're welcome. I think that's all we have time for today. I want to thank you for tuning in. We're going to do more episodes. We're going to have guests in here with me, and I'm going to bring more Psychology 101 to you. We're going to talk about everything under the sun. I'm Dr. Fritz Gillette.